to On the Edge with April Mahoney Brains. How are you today? How you feeling? We're about to find out. You're at the spot, the place, the location. Conversations are pointed, the guests are sharp, and the responses are never dull. Today we're going to Chicago, and I hear it's pretty warm there. We're going to visit with Dr. Maria Torres Moore. She is a medical doctor from Mexico, but now she is shifting her modality a little bit more towards the alternative medicine side. She's seen what westernized medicine does, but she's incorporating some different modalities. Very herbal, very traditional, very tribal, very holistic approach. I want you to pay attention, brains, because it is a whole shift from going from one to the other. I also want to put out a disclaimer. In the event that you are under a doctor's care and you are taking any course of treatment, please continue with this treatment. We provide you this information as an alternative resource. Please do your due diligence, investigate, contact my guests afterwards. But if you are under doctor's care, we encourage you to keep that same form of treatment. So before we get all discombobulated, we want to talk to Dr. Maria Torres Moore. How are you?
I'm doing well, April. Thank you for having me.
Absolutely. So I want to talk to you about this because I'm reclaiming my health. Me and Mr. Magnificent are reclaiming our health. There's so many things that you kind of forget about or you really don't take into consideration. Number one, stretching. Oh my God. Just a little bit of stretching, 15 minutes in the morning, 15 minutes in the evening, has done my body good. Stimulating the mind. We already know about diet. We're going to talk a little bit more about that because the food that we eat is tainted. I've traveled the world, and a banana doesn't taste the same in Thailand that it does here in San Diego. So we're going to talk about that and herbal medicines and alternatives, a whole lot more. So Dr. Moore, please tell my brains a little bit about you, your history, and how you show up in the world.
Thank you, April. I will be happy to share that with you and your listeners. So I was raised and grew up in Mexico City, to be precise. I did study medicine, so I graduated from medical school, and I practiced medicine for several years, many years, as a matter of fact. And I was shocked to see how the chronic diseases and cancer and all those conditions were in the rise. So I've been always passionate to be healthful, and that's why I turned myself into a medical doctor. So I was so deep and so concerned about that I joined the pharmaceutical industry many years ago. So I did a lot of work in pharmaceuticals, including clinical research, which was fascinating. So it was all about finding the best remedies and best medicines for different conditions. And actually it was intense. It was very, very interesting. I learned a lot. And I respect what the scientists do for all of us so we can improve our I would say, illnesses. But honestly, I realized that all this science, all this medication were so important, but a lot of times when people need those medications and those advanced therapies, it's already a little too late. So a lot can be prevented, a lot can be resolved way ahead of time. And that's when I decided to work in a different field. And I decided to work more in the health industry more than in the disease industry, which I kind of conceptualized. It's not one versus the other, it's together. And there's a place to natural medicine, to alternative medicine, and obviously Western medicine, science is important to have it as well. But we need to combine the two concepts. And my dream is that one day we can all talk in the same way, in the same fashion, and just go for the best of human good.
Well, I'm going to be the devil's advocate here. Sick people are big business. Well, people are not big business. You worked in the pharmaceutical industry. I don't have to tell you that. Um, it's hit and miss. I mean, you're looking at these weight loss drugs right now, and that control diabetes and weight loss. People are running rampant over it. It's the next new shiny object. But longevity and stability, and we fall off. Come on, you're adolescence, then you're going into teenage, then you're eating fast foods, then you're hanging out and you're drinking and you're smoking and you're partying and having too much sex. Then you go to the part where you want to have children, your body changes again, men and women. Then you go through the menopause. But somewhere in between there, you forget, I'm not eating properly, I'm not sleeping properly. I don't look at the color of my bowels or my urine to see if there's anything going on. I'm not checking my blood pressure. It's prevention. And I know when I traveled to Asia, I absolutely loved it. They checked my liver, my kidney, and my spleen right here. They looked at the side of my tongue. They looked at the color of my tongue and my eyes. There was none of this probing and getting a blood test and checking your A1C. And they didn't do any of that. And I'm telling you, it was amazing what they realized just externally, because you exude what you are. So, Dr. Moore, in doing all of this, can you also share with people that this is a lifestyle change? This isn't just a quick fix like popping that pill. This is something that's ongoing, correct?
Exactly, exactly. That's part of my mission. And I'm so glad to talk to people like you who are already in that realm, because that's true. We are not we cannot fix things with one pill or one injection. It's not possible. So we need to change the way we think. As a matter of fact, one of the best teachings I've received is how in China, for instance, they used to pay the doctor only when people were healthy. They will not pay. They will not
I know.
pay the
That's
Chinese
crazy.
doctors when the community got sick. So it's exactly the opposite. We should work to keep everybody healthy, so we don't need extra money to fix things. Also, we should not lose time and life and family fortune or
But it's preventative. It's like they drink, certain teas every day. They walk every day.
yeah.
They
It's
walk every day. I see my neighbors, I know they're from China. I can set my watch by it in the morning and in the evening. And she's on a walker. They are diligent about that. Eating things like the purple eggplant, just being mindful too, and being conscious and being kind, and a sense of community and family. That makes all the difference in the world. All the difference in the world. So
yeah.
tell me a little.
I do practice acupuncture, but I don't. It's acupuncture is like the people thinking people just for muscle spasms and pain, but it's a whole system of medicine. That if you find a traditional Chinese medicine practitioner, they would use acupuncture. They would use some type of
At your
massage.
point, my husband was in Thailand and had a heat. Just I thought he was going to pass out, and they just cooled him down and hit certain pressure points, because a lot of things can be handled externally, as we were speaking about.
Exactly.
And but we want a quick fix. We want it instantaneously. We want it right now. And people don't want to do the work. Like I said, I got a muscle spasm, and doing that little 15 minutes in the morning, 15 minutes in the evening saves me from taking 4 Tylenols in the course of one day. Shout
Right.
out to Tylenol. But seriously, it's a lot. So let's go back a little bit. Let's talk to the person that is looking to seek out alternative medicines. What things should they start charting? Because we know what their symptoms are. Should they start charting what they're feeling, what they're eating, what they're doing? How do you begin a process and then transfer over to working with a professional like you?
I would say the first thing is to be open for sure. And they don't need to track anything. They just need to discuss with somebody who is willing to listen and who has the time to listen. That's the first thing. Because there are things that we believe we have a problem with, and we do. But underneath, there's so much hidden that somebody who more understanding and listening skills can grasp and find exactly what's going on with the person. Let's say just to mention something, I don't know, headaches, for instance. So there are so many types of headaches that there are there, and the frequency is different, the intensity is different for everyone. So that is part of the intake that the practitioner will consider. And not only that, they will consider whole other symptoms that go with it. And so it's more like being open to discuss and to be willing to find a different approach. That would be my suggestion. Not so much as charting, because charting becomes very, I would say,
Maybe routine?
yes, and you will chart what, for instance, for a headaches, how often do I have them? But then the doctor will ask you where are they located, on what's the intensity, and you probably might not have recorded that. So that doesn't make sense. To just go and get a second opinion or a first opinion that will say. That's part of what I'm trying to let people know, that it's important to have the mild conditions, mild concerns. When somebody is starting to bugging you, just go to an alternative complementary medicine doctor.
Mhm.
In addition to your physical, your regular PCP visit, that's an addition. But there are things that the doctor will not even pay attention to because they're so minor and they are there for serious conditions. So when you have something mild, just try to address it with a more natural way. So that's when you go to the naturopath or you go to the alternative medicine doctor.
All right, so let's pump the brakes right now because these are big $25 words, and people just assume that they know what they mean, and they don't. Okay, that's like the difference between a dietitian and a nutritionist. Two different functions, you
Mm.
know. So people have to understand, you know, you don't go to you have a general practitioner, but if you have heart problem, you go to a cardiologist. So now when you talk about alternative medicines and holistic approaches, are we looking at things that I'm just going to list some and you can color in the white spaces? Are we looking at acupuncture? Are we looking at pressure points? Are we looking at massage? Are we looking at things like Reiki? Are we looking at, again, I don't, I never say it correctly, Ayurveda, eating from
Mhm.
India?
Yeah,
You know, that,
Ayurvedic medicine,
right,
yeah,
Ayurveda, herbs, supplements. Are all of these things included under this umbrella called alternative medicine?
that's correct. That's correct. And
Yay,
every
brains, I got it.
yes, you do have brains. Come on. So yes, so that's the thing. Every discipline has their way to address those minor conditions in general. Obviously, I need to say that it's the best to have somebody who understands the bigger perspective
Mm-hmm,
to make sure that all the areas are covered. For
mm-hmm,
instance, even though I do not practice Western medicine right now, but I can direct people to go to their doctor
mm-hmm.
to double check or to make a medical diagnosis and treat if I see something that is concerning. But there
Mm.
are so many other things, like 80% of the conditions are, I would say, simple yet simple conditions, simple remedies that can be taken.
Okay, let
Go.
me ask another question really quickly. As I explained uh, previously, that I went to a Chinese herbal medicine and brains. I'm not being, racially biased or anything, but let me tell you what I've heard. I've heard that you need to get an Indian doctor, a Mexican doctor, or a Chinese doctor, and you will live at least 10 to 15 years longer. I don't know. I'm not saying nothing wrong with the Black Americans or the white American doctors. I'm just saying because they are rooted in history, in years, thousands, century old medicines and herbs. This is how they healed themselves. I mean, they would just grab a coca leaf and chew it, and they'd be fine before somebody realized how to make rock cocaine. So, take this into consideration and look at the person, look at their history. I was talking to Dr. Moore. She was telling me about her abuelita. You I mean, did you? I mean, didn't she? She's the one that started you in this trajectory of really kind of learning what these natural herbs were. It's come down from centuries. Am I right?
Yes, that's correct. Exactly. That's one of the reasons why I became interested in medicine. Because my grandmother and my mother, they use remedies, teas, and
Mm.
my mother was in the pharmacy industry as well. So I kind of became acquainted with all those things. But let me tell you something. The reason why it took me so long to go back to take this route of alternative medicine is because I didn't know where to start, because there's so many, I will say, skills that might have helped me. But what helped me the most was that I found Chinese medicine, and I did a master degree of 4 years in traditional Chinese medicine. And that's when I learned not the entire philosophy, the entire approach of holistic approach to medicine from the Chinese doctors. And I learned acupuncture, Chinese medicine, Chinese herbs, and other modalities. And even though I do not speak Chinese, but I got to know a lot about about their philosophy and their ways to treat. So that was huge for me, and that's how I it's part of why I'm doing what I'm doing.
Well, let me share something with you. This is a strange story, Brains, but I love to share a story with you.
Oh.
So I go to China again. I was on a spiritual quest. Okay. I had some dreams and some things that led me to that, to know that in a previous life, I was Mongolian. And I had to figure that out. And when I went there, that's a whole nother show, Brains. But I tell you, when I went there, it was mind blowing. So I see this doctor. And then downstairs, there was an herbalist. I mean, there was every kind of root and bark and tree branch that you could imagine. I was like, what is all of this stuff? There was bugs in there, all kinds of stuff. It was a Chinese medicine thing. So I said, okay. I was a little nervous. I said, "Oh, if I start this regimen, I'm way in Beijing. I'm not going to be able to get it in San Diego. It's going to be a problem. Can't ship it in or whatever." I said, but I'm going to take some things home. Long story short, I brought some teas. Well, they have tea for everything. Make it beautiful, make your tea strong, make you brainy, all kinds of stuff. Well, when they served me the tea, they served it to me in a little 3, 4 ounce cup. No, not me, greedy American. I make 2 mugs full and drink it. And let me tell you, I was high as a kite. Dr. Moore, I was hallucinating. I was seeing rainbows and unicorns. I was high as I don't know what. And when I was sitting there just like frozen, and my husband goes, "Baby, what's wrong?" I said, had some tea that I brought back from China. I said, and I have not been the same. And he goes, "Well, how did they serve it to you?" And I said, "Well, little cup." He says, "You've probably taken 10, 12 times that amount." Brains, understand that this is nothing to play with. It's nothing to play with. You need to be under the guidance of a trained professional that knows the dosage, that can compare to your body weight, that can compare to your symptoms. You cannot just go in and say, "Oh, okay, give me this, this, and this," and think that you know what you're doing. Because I thought I know what I was doing. And I told the good Lord, I said, if you get me down off this cloud, you don't have to worry about it no more. But again, it's a process. Now, if I did it and followed the instructions, did it incrementally, it probably would have, did whatever it was supposed to do. But I got scared. So I say that to say this is that you really need to understand what you're doing. You can't just go into this blindly. And again, it's a lifestyle. If you're going to be doing a certain regimen, don't you need to continue that? Some things you might be able to do 6, 8 months, turn it around. But if you got long-term chronic illnesses, and we can just throw out a couple, we could say, migraines or PMS or menopause, all of these things, they take a while. And it takes a while for your body to adjust. Wouldn't you agree, Dr. Moore?
Yes, totally. And you said something very, very important, because you can find all kind of herbs in Chinatown or in any natural store.
Online.
Online, you can find anything, and there are a lot of there are trendy things, but no, you're right. It needs to be under the supervision of a qualified practitioner. And what happens a lot of times is that some patients take their herbs that are taken from, let's say, a Chinese doctor to their doctor, to the medical doctor, and they say that's okay. And obviously, the doctor doesn't know what is it about. It's a completely different training. So that's why it's important to
And it
find
could
a
be
qualified.
and could there be adverse effects? I mean, you're taking one thing for blood pressure and then you're taking these blood pressure pills too. Your blood pressure could plummet.
They can have, of course, herbs are mild but can interact with medicine. Of course, that's so important, and that's part of the reason why it's don't take it so lightly. I mean, it's good they are mild, but you need to consider, if you're taking medication, you have to make sure that they don't interact. And for that is, well, it's hard for the doctor to say that they will interact, because they don't know what's in there.
Right.
So again, the certified herbalist will have usually the training, not only to use the right combination of herbs, and to avoid the when they are in the presence of medications such as blood thinners, high blood pressure medication, diabetes medication. There's a lot. So that's
Now,
why.
let me just jump on two medications. And this is just I'm going to use very general, okay? Because I have a lot of questions about it. Number one is marijuana. Well, it's not the weed that it was of the 60s. It's not the weed that the Native Americans smoked. It is genetically modified now. It will do everything for you. It'll appetite suppression, headaches, seizures, all of that. I know that cannabis has a place. It always has, but it used to make you happy, horny, or hungry. Now it does a whole barrage of other things. And now they're genetically modifying it with these edibles. They think that this is the most, it's trendy, but again, it should be under a doctor's care, not confused as recreational. The second thing I want to ask you about is these weight loss drugs. I don't know. Now, again, you've had experience in big pharma. We're not trying to name one over the other, but it is controlling diabetes and it is controlling weight loss, but it's also becoming very trendy. What is your position in general on those two topics, if you'd like to share?
Well, about cannabis, you say it. This is trendy, and there's a whole industry now behind that. So that's another story. In general, I use the herbs for their, I'll say for their natural form, or as much as a decoction or tinctures. Cannabis has been used for in tinctures for years and years and years, for hundreds of years, for joint and for pain. So
Okay,
that's
wait. I'm sorry, because I want to get the definition of that. A tincture, is that what you put under your tongue, or is that a topical that you put on? What is it?
Topical.
Okay.
Topical. I think I know that grandmothers will have it in a bottle of alcohol and then will just rub it on their
My friend's mother used that green alcohol and buys her the best weed they have and put it in there, and she says it gets rid of that arthritis.
And it's that for that is good. The rest I honestly I don't use it. I don't recommend it because I don't think it's necessary.
Okay.
So that's my take for that. I don't have anything else to say about that.
Yeah, and to each his own, but I like to ask a medical professional because everybody just swears by, oh, CBD oil. And I had a great guest on that is a strong proponent in Canada on doing extracting the THC and using the cannabinoids for seizures for her son. She says it helped save his life. I don't know. I can't dispute either way. So now, what do you think about the weight loss drugs?
So let me just add a little bit about the terpenes and the purified components from herbs. Those need a lot of study because once you bring up this extract, they are so powerful that the dose has to be measured, that has to be studied, and all those things. And I know there's studies going on for that, and I'm glad it's the way a lot of pharmaceuticals were created, from herbs that they purified and they studied and they did find the right dose to produce certain effect. So it's following the same path as many medications in the pharmaceutical industry. So it's following the pharmaceutical path, which is fine. Needs study, needs documentation, and needs approval from FDA and equivalents, because it's to treat a disease, and it's okay, it's good. That's a different thing. So in terms of weight loss, again, there are trends, and now the trends now come from the pharma as well. Again, it's a whole industry, and it's okay. I mean, it's okay. However, I do believe that the best way to keep I would say healthy way is by following what your body needs and keeping a healthy state of mind and just having a healthy lifestyle. Because the moment you stop taking whatever drug is said, then you bounce back not once, but sometimes 5 times more in weight, because there's a rebound. Your body kind of rebounds. So what we need to do is just really, really adopt a really healthy lifestyle. And for some people, it's hard, but there are different ways to work through, with psychotherapy, with a good nutritionist, dietitians, with coaches, with exercise, supervised exercise, and other things. So that's where it has to be more integral, the right approach for weight loss.
Because again, it's jumpstart, but you still have to stay consistent. Brains, all this basically is also teaching you consistency and discipline.
Mm-hmm.
You can get on the weight loss drug, or you can, get on the, think that your migraines are being controlled by cannabis and get off of it, but if you try to work other alternative things, yoga, Reiki, again, like you said, therapy, going for a walk, breath work, all these other alternatives can really support you as you make the transition. Because again, do you want to jump from the pot to the frying pan? You're off one thing and now you're addicted to something else. I see that, people that get out of recovery, they'll go to the rehab center and they may get off alcohol, but they're on coffee and cigarettes. It's one crutch to another. So it's really about being disciplined. Thank you so much for all of your information and being so honest and candid. But let's ask you some fun questions. Okay. I like to do that. I want to get to know you. See your pretty
Okay.
smile. If I came to your house for dinner, what would you make me to eat?
Hmm. I will do some salmon, like
Mm,
grilled salmon, and I will make some maybe some green beans and rice.
okay.
That would be my quick. If you come just all of a sudden, that's what I would do.
Are we gonna have water or are we gonna have wine?
Hmm. Maybe maybe a glass of white wine. Maybe yes.
Maybe. Okay. I thought you were gonna say red because it's good for your blood, but I think you eat white. You have white wine with fish, so I got that. If
That's
you
probably.
were an animal, what animal would you be, Dr. Moore, and why?
Probably I would be an eagle.
Mm,
Like eagles
why?
because they fly very high and they have very good vision and they're very precise.
Okay.
So and they're beautiful.
Very detail oriented. If you could time travel, if you go to the past, stay here in the present, or move to the future, where would you land?
Wow. I'm happy with my present. I don't know. It's if I went to the past, maybe I don't know.
No.
Hmm, I probably would like to assist somebody like Madame Curie when she was doing research for X-rays and things like that. Maybe
Yeah,
that
I
would
kind
be.
of thought that you might go to the past so that you could see exactly the origin of where things came from. Me, I'm going straight to the future. I'll wait for you.
Okay, that's
If
good.
you were an appliance in the kitchen of all places, what appliance would you be?
Okay, I think maybe the tea kettle.
Hmm. Why?
I don't know, just because it takes the time to just warm water and boil it.
Yeah.
And when it's boiling, it just makes noise and lets
I think
everybody
I'd
know.
be the I think I'd be the air fryer.
Oh, okay.
It's new, it's trendy, it keeps it juicy and crispy. You use a little bit of oil, it's easy to clean. I'm the
Oh,
air
okay.
What
That's fun.
conversation would you have with a 25-year-old Dr. Maria Torres Moore?
Oh my goodness. That's amazing. An amazing question. I will say just trust in yourself. Everything is going to be great. Keep the stress low as much as possible. Eat, learn how to eat well, and keep your body strong and flexible. That will be my.
That's great advice. That is great advice. And leave us with some sort of inspiration, for us to stay consistent. Why do, you know, I don't know. I talked to my mother as she was transitioning, and I asked her, I said, I was 91. And she said, it's the pits. I said, it's the pits. She goes, yeah. But now people are going to easily live to 100. She lived to 91, 92. 100 is not going to be that far away. But do we want to live that long? I mean, honestly, all the great herbs, medicine, exercise, it's going to break down eventually. 85, 90. It doesn't have to.
That's what I would say. It's whatever, whenever, whichever point in your life you are, just make sure that you keep your body strong and healthy because you're going to live long. and you want to be self-sufficient, you want to be agile, you want to be just moving all the time, as long as you live. So, because at the time we are going to the middle age, we all get stiff. We cannot even get out of the floor, and we just get a chair all the time. Versus making sure that you have strength in your muscles to get up by yourself, and that's the way we all should be. So,
Also, a big muscle that we need to exercise brains is our brain.
right.
Learn to play an instrument, continue to read books. Me and my husband love to do puzzles, play games, have conversation with younger people.
Wonderful.
You
Yeah.
know, these are the kind of things that are going to stimulate your mind, because we hear things like Alzheimer's and dementia are, you know, it's right up there with heart disease and high blood pressure and diabetes. They're running neck and neck. So everything. Thank you so much, Dr. Torres Moore, for being here with us on The Edge. I really appreciated you. I wish you were here, because I sure would get my insurance company to approve me working with you. I sure would. But you know what? I'm sure that there's some offerings that you have or information you have that you're doing online. Can you share that with my brains and how to get in contact with you?
Of course, as I said, I have my practice in Chicago, but I am doing a lot of coaching online, and I can help people with a video call in different ways. Yes, my website is vitality.club. I will, and also you can find me on Facebook. Cristina Torres Moore. I'm gonna provide the links for you to share with your viewers and listeners.
Yes, absolutely. Brains, it's always a choice. The other word for choice is alternative.
Right.
Okay. So look at some alternative options. Again, I'm not telling you what to do against what your doctor says, but you don't know what you don't know. And everything is quick and slick right now. But if I can regain or gain 10, 15 years to what I have now, I count it all joy. Thank you so much, Dr. Torres Moore, for being on the show with us. Brains, I need you to go in and subscribe. Please help me raise those numbers. They're already great, but I want them amazing. Love, like, share, and subscribe. Go in, have a consultation with Dr. Torres Moore. You cannot go wrong. Information is power. It's only powerful when it's applied. Thank you so much for being on the show, and I will keep in touch with you. You're a jewel.
Thank you. Thank you very much.
Bye, Ray.